Welcome to Mayo Clinic Radio. I'm Dr. Sanj Kakar.
And I'm Tracy McRae.
Fibromyalgia is a condition that causes pain all over the body, sleep problems, fatigue, and often emotional and mental distress. Researchers believe that fibromyalgia amplifies painful sensations by affecting the way your brain processes pain signals.
According to the Centers for Disease Control and Prevention, fibromyalgia affects around 4 million U.S. adults, or about 2% of the adult population. And here to discuss fibromyalgia is internal medicine specialist Dr. Christopher Aakre, who works in Mayo Clinic's Fibromyalgia and Chronic Fatigue Clinic. Welcome to the program, Dr. Aakre. It's nice to meet you.
Thank you for having me.
It must be a pretty severe problem if Mayo Clinic has its very own fibromyalgia and chronic fatigue clinic.
I wouldn't say it's a severe problem, but it's one that's very commonly encountered, and a lot of people have it. And it's one of these conditions that often goes years before we get a diagnosis, and it really does affect people's lives.
What causes that pain?
It's unclear. There's a lot of thoughts in terms of what might be behind it. Often there are some conditions that have happened in people's lives that are traumatic, involve illnesses, that then will serve to basically traumatize a certain part of the brain, and that is thought to then lead to amplification of these signals associated with pain and other symptoms.
So I think that's one of the first places that people get confused, is that people will think, is it psychological pain, or is it real pain, or is it one and the same?
It's definitely real pain. If you talk to people who have fibromyalgia, they do feel severe pain most days, and it's a lot more than the pain that you and I would normally feel. So the thing we think about with fibromyalgia itself is when you have pain, normal everyday aches and pains that you have are going to hurt more than they otherwise would. We call this hyperalgesia. The other side of things that can happen with fibromyalgia is also what's called allodynia, which is things that ordinarily wouldn't hurt, such as touching the skin, will hurt. And those are really the two key things that we see as a part of fibromyalgia.
So, Dr. Aakre, what causes fibromyalgia?
Again, this is something that we're not completely sure. It's poorly understood in terms of the exact cause, and it seems to be a little bit different for each person. One thing that we do know just from twin-based studies, that it's about 50% environmental, about 50% genetic. Wow. And this is why we will see that often when someone has fibro, we'll see family members who've also had fibromyalgia or similar symptoms.
If you have fibromyalgia, do you have pain all over your body, or is it like a joint, or just the back, or just the feet? How does it work?
So fibromyalgia itself is basically characterized by widespread pain, and so it's more than just one joint. Often one of the places we think of fibro is in the cape region, so the upper part of the back, the front part of the chest. But in general, it is widespread, involving more than more than 3 of the 4 quadrants of the body.
And do we know why that's so widespread?
So it has to do with just widespread pain amplification. And so rather than so for example, if you were to have knee pain, you would have knee pain and just experience that in that joint. With fibromyalgia, you would not only experience the pain from your arthritic knee, but also pain from other parts of your body, and all of this would be amplified. Mm-hmm.
So there are risk factors associated with it? You mentioned the genetic linkage. What about other risk factors?
None as far as we know.
Okay. And then, as you say, pain can be very subjective, and there's different types. There's burning pain, sharp pain. What type of pain is this?
So often our patients will describe it as a achy pain.
Okay.
Sometimes, though, it really depends on what the underlying pain is. And so with fibromyalgia, you'll end up with a amplification of other pain you might have. And so let's say you do have arthritic joints. The pain from those joints will be amplified, and so that can be a dull aching pain, that can be a stabbing pain. It really depends on the underlying character, but whatever type of pain it is can be amplified. You mentioned neuropathic, kind of that pins and needles pain.
Yes.
That can be amplified as well. And so some of our patients who have this but also have type 2 diabetes with neuropathic pain, that can be very debilitating because that pain is also made worse.
What's the difference between chronic fatigue and fibromyalgia, or are they one and the same?
They're not one and the same, but there is often an overlap. If you were to look at patients with fibromyalgia, about 60 to 70% of them will also meet the criteria that we go by for chronic fatigue syndrome. They are very much related in terms of some of the things happening behind the scene with the processing of pain signals. Turns out a lot of the signaling that has to do with fatigue is also moderated by pain nerves. And so that's where a lot of the overlap comes from.
So if someone has one, are they more likely to develop the other?
Not necessarily develop, but it's just an association that we know that fatigue is a big part of what we see with fibromyalgia. And a lot of times people with fibromyalgia will also have a lot of the severe debilitating fatigue that we'll see with chronic fatigue syndrome.
They're cousins, Tracy.
Somewhere in the family tree.
So when you try and diagnose this, how do you do it? Is there a test for this? Is it based on the history?
So there's a few things, and this is going to go through a little bit of the diagnostic history. Mm-hmm. So back in 1990, it was when the American College of Rheumatology came out with a set of criteria based on tender points. So more than 11 of 18 tender points in various different parts of the body. This did a pretty good job with identifying some patients with fibro, but did leave a large group of patients who have this condition off, mainly men. And so through a series of changes in diagnostic criteria, starting off in 2010, 2011, the diagnostic criteria has changed, where we no longer are using those 18 tender points, but now look at pain in widespread parts of the body, and also with other symptoms such as cognitive symptoms, sleep symptoms, and fatigue symptoms. And all these really do play into the current diagnostic criteria for this.
So there's no sort of blood test or an X-ray or a bone scan, for example?
There is not. One of the other key developments within the new, most recent criteria in 2016 is it's no longer a diagnosis of exclusion.
That's what I was going to ask next. Is it just because it's not anything else, and that's how you finally get to, and so it must be fibromyalgia?
Absolutely not. So it's one of these conditions where you can absolutely have fibromyalgia plus lupus, rheumatoid arthritis, or any other condition that causes pain. What is behind fibromyalgia is the amplification of these normal pain signals. And so often what we think about with this is if you have one of these other conditions and the pain that you're experiencing is something where it's much more than you would expect based on the degree of pathology. So if you have arthritis and there's not very severe inflammation or joint destruction, this could be something where your pain is being amplified, and fibromyalgia should be something that you should think about as a reason for that.
So apart from living with the pain, if you ignore it, is there any complications or anything bad that can happen to you?
No.
Okay.
You're just in pain all the time, which is kind of affects your quality of life. I mean, I'm not a doctor.
Yeah, no, it would do.
And so it really depends on if the cause of that pain is something that otherwise needs to be treated to prevent other bad things from happening, then of course that should be looked into. But what a lot of we spend when it comes to treatment for this is to get the mind not focusing on the pain as much, but more focus on what you're able to do and to improve function.
Dr. Kakar had asked about if there was a blood test, and that would certainly make things easier if you could do a blood test to find it.
Absolutely would.
But you had mentioned previously that it does show up genetic-wise. If you go and get a genetic profile done, does it show, oh, you are likely to have fibromyalgia?
Unfortunately, not. There have been genome-wide association studies that have looked, and they look at these large data sets and identify some correlations that are definitely not causative. We have not identified one specific gene with this, or even a cluster of genes that are thought to be behind this. It is one of these things where we just notice that people who are twins who have been raised in similar environments versus different environments, there appears to be about 50% contribution from each.
It's got to be frustrating for patients to not be able to, have it diagnosed by something that's like a blood test, something, I don't know, finger quotes, easy.
Absolutely. And a lot of times our patients will go many, many years without a diagnosis. And they'll come and visit with us, and we'll start kind of putting two and two together, connect the dots, and really does explain not just the pain symptoms, but the whole host of other symptoms that we'll often see with fibromyalgia.
Does it come and go? Is that why it can take so long, too, that they'll have some good days and some bad days, or is it pretty constant?
Absolutely. So one common thing a lot of our patients with fibromyalgia will experience are good days and bad days. Some days they will feel great, do too much, and then pay for it the next 2-3 days in both pain and fatigue.
Well, I think, in 2019, we're a lot more aware of this. I mean, I think when I was in medical school, as you said, it was a diagnosis of exclusion. But now I think with, as you said, the criteria for diagnosis, I think more of us in the healthcare arena are more aware of this.
Yes, it is something that is becoming less taboo. is one way to put it. Where a lot more clinicians are starting reaching out to us and trying to understand and learn more about this condition that they may not have heard about as much during medical school.
We've been discussing fibromyalgia with Mayo Clinic specialist Dr. Christopher Aakre. We're going to take a short break, and when we come back, we'll talk a little bit more about treatment options and discuss what's happening at the Fibromyalgia and Chronic Fatigue Clinic at Mayo Clinic.
Welcome back to Mayo Clinic Radio. I'm Dr. Sanj Kakar.
And I'm Tracy McCrae.
We're talking about fibromyalgia with Mayo Clinic internal medicine specialist Dr. Christopher Aakre. So, Dr. Aakre, if there is no cure for fibromyalgia, what hope can you offer patients?
So the way we approach fibromyalgia is really to try to identify if there are ongoing stressors that might be contributing to the continuation of the increased pain. And so that's step number one. And so in doing so, we try to identify different approaches that might work depending on each individual patient. And so,
how do you do that?
So meet with them, find out a little bit more about the background, how the process developed, what has been tried in the past, what has not been tried, and then start there.
A little bit earlier, before the break, you mentioned someone can feel really good and then maybe be too active and the next day pay for it. What is that? What do you mean exactly when you said that?
So when you talk with people who have fibromyalgia, they'll tell you they have good days and bad days. Mm-hmm. And so life happens. And whether or not you feel good or you feel bad, things start to add up on your to-do list. Mm-hmm. And when you have these good days, a lot of our patients will feel very much like they have to go and complete everything on that to-do list. And then, of course, the next few days is when they pay for it, meaning they have more pain, more fatigue based on overdoing it.
That's what I was wondering. So there's what they usually would experience as pain is just amplified even more?
That's correct.
Go ahead.
So how do the symptoms then relate to one's psychology? So, for example, in the winter seasons where you get seasonal affective disorder, does that sort of lead into patients having more symptoms associated with fibromyalgia?
So a lot of the time our patients are living in chronic pain. And chronic pain in itself is something that can make people's mood feel down. And so when certain symptoms are also known to be made worse over the winter months, all these different things can stack and certainly can amplify certain symptoms.
Tell us a little bit more about the fibromyalgia and the chronic fatigue clinic at Mayo Clinic. How many patients do you see?
Absolutely. So we see about 50 per week over there, and we do an evaluation to clarify that they do have fibromyalgia. Sometimes we do see some other conditions that are mimickers, and we try to rule those out. And then we'll also see people with chronic fatigue syndrome. And so once we have established the diagnosis, we spend a lot of time, about an hour, on just education. There has been a lot of misinformation about fibromyalgia itself over the years, and so we spent a lot of time knocking down some of those myths, as well as helping people understand what they're experiencing in addition to the pain symptoms may be contributed from fibromyalgia.
I was wondering about that, if you're seeing patients or also you're helping to educate providers.
So if you've seen one of our clinical notes from this, it's quite long and detailed, and a lot of it is targeted because the way we use our notes nowadays, where you can go ahead, print it off, and bring it back to your local doctors to help continue care. And so we do a little bit of both.
So when you talked about the myths associated with fibromyalgia, what's the one myth today that you want to dispel about that condition?
It's all in your head. Because it's not.
Okay.
And you talk with our patients with fibromyalgia. This is clearly a pain that they're experiencing and affects them day in and day out, and really does affect their quality of life.
That's a huge deal, though, just to expand a little bit, because if it's all in your head, the patient, the caregivers and family members, and the providers, if all three different areas are some version of it's all in your head, that's a huge part of this illness.
Absolutely, and telling a lot of our patients as we're going through the education process, all the information that has come out that really dispels that myth is really powerful, and basically getting them to the point where they're understanding that what they're experiencing is real, despite what they've been told over the last 5, 10, 20 years in some cases, can be quite powerful.
What are some treatment options that you have for patients?
So one of the difficulties with this is a lot of the medications, or people with fibromyalgia tend to experience more side effects with certain medicines than others. And so often our medication that are available to us, we're really limited to how high of a dose you can go up on based on side effects. And so there are a few SNRIs that are available that can be used. There are a few gabapentinoids that can be used for this. But some of these will make you more sleepy. Some of these will cause dry mouth, confusion. And so a lot of the first-line therapy we think of for this is not pharmacologic.
You know, the first thing I want to ask you is, why are people more susceptible to side effects? And I bet you don't know.
We don't know for sure, but one of the things with fibromyalgia and this underlying concept called central sensitization is sensory signals are being amplified, whether it's pain, fatigue, but also some of the other sensory modalities that the body has, including things that happen within the GI system. We see a lot of our patients with fibromyalgia have an amplification of GI side effects such as nausea and the stomach discomfort. And these are often the side effects that cause people to stop taking these medicines. And so we really do think a lot of it has to do with this amplification of sensory signals.
So if we move away from traditional medicines, are there any alternatives that one can use to treat fibromyalgia? Yes.
So a lot of what we do from a non-pharmacologic side, so beyond education, part of it is lifestyle, is promoting a healthy lifestyle change, focusing on wellness, focusing on things like biofeedback. A lot of integrated medicine approaches that work towards pain reduction and reducing the nerve hyperactivity.
I see. Now, a lot of fibromyalgia patients have genuine organic pathology and may need an operation, have surgery. But as a surgeon, we're worried about operating on these patients because we think we'll make their fibromyalgia worse. So can you sort of explain what one should be thinking about when we're treating fibromyalgia patients if we're thinking about doing a surgery?
Absolutely. So if you think of fibromyalgia as a normal pain that you would have being amplified, that's not tough to predict what might happen after a surgery. So surgery is painful. And so what we tell our patients is to expect that after surgery, you're probably going to have more pain than the person that's in the recovery bed next to you, and anticipate that. And as a result, you may have a little bit more difficulty with getting adequate pain control after surgery. And so sometimes we'll tell our patients that if there are ways that you can delay putting off an elective surgery to focus on optimizing risk factors or maybe pursuing non-surgical options, sometimes that can help from a pain standpoint. But if something where you do need to have surgery, whether it's elective or whether it's non-elective, then expect that your pain will probably be worse than other people.
If on the one side of the coin, what patients hear is it's all in your head, I would think on the flip side of the coin, that would mean that mindfulness and biofeedback and those things have to be very helpful.
They can be. And so when we've followed our patients at the Fibromyalgia and Chronic Fatigue Clinic for some time now, what we've identified is that a lot of our patients will have a pretty significant reduction in their pain levels and improvement in functioning without initiating any pain medications through the integrative medicine approaches, biofeedback, mindfulness techniques, sometimes things like acupuncture, acupressure. Massage therapy, all these things can be very helpful with reducing that nerve hypersensitivity.
What's the one thing that works the best? What's the first thing that you tell patients to try?
Honestly, I don't have one thing because it really depends on each individual person's kind of preferences. There are some of our patients who love massage and some that will, that's the worst thing you can possibly think of.
And what about research? What research is being done?
There's a lot of ongoing research into underlying mechanisms for this, and some more research ongoing into different types of therapeutic options. Not much of it is ready for prime time, though.
But yeah, you can give a prescription for massage. I think I've got some trigger points as well after hearing that, Dr. Aakre.
We've been discussing fibromyalgia with Mayo Clinic expert Dr. Christopher Aakre. Dr. Aakre works in the Mayo Clinic Fibromyalgia and Chronic Fatigue Clinic. Thank you for joining us.
Thank you for having me.